Biomarker-defined multiple myeloma is an important issue because those patients are thought to have a high risk for fast transformation into active myeloma. And actually the initial reports indicated that, for instance, patients with a high number of bone marrow plasma cells, 60% or more, have a short time to transformation, 6 or 7 months. And the same was true for patients with a free light chain ratio of 100 or higher, and the same was true for patients, or is true for patients with focal lesions, which are defined by MRI, one or more focal lesions defined by MRI. The risk to transmission to multiple myeloma, the time to transmission is about 15 months. But now we have more data than data were available in the early days. And then it turns out that particularly patients with free light chain ratio of 100 have a much longer time to transformation. So their 2-year risk for transformation is down to 45%. So that is different than was initially thought. So that is important for clinical practice because one should be careful when you consider initiation of therapy. You should use other parameters, particularly dynamic parameters, which indicate that the disease is progressing. And that is also true for a patient with high bone marrow plasma cell infiltration. The time to progression is now 15 months when you meta-analyze all patients. And again, there are some patients who won't progress, and I follow 2 of them, which with 60% of bone marrow plasma cells and more, and did not progress for several years. So it has to be carefully discussed with the patient. A risk assessment has been taken, has been made, and benefits have been discussed. But it's not, as was initially thought, that everybody fulfilling these criteria should immediately start with anti-myeloma therapy. That is the main message.